When you think of a stroke, kids don't necessarily come to mind, but it can happen. And here for Stroke Awareness Month and to talk about this life-threatening issue is Dr. Schwartz, a pediatric neurosurgeon with Palm Beach Children's Hospital. Thanks so much for coming in. How common is this?
So stroke in children is not very common compared to stroke in adults. However, when it does happen, it's something that with the proper recognition and attention to medical care, we can save children's lives. So it is important.
It was really surprising to me. It can actually happen before they're born.
Correct, yes. And so it's not as uncommon to have a prenatal stroke. So we actually have a program at Palm Beach Children's Hospital where if a mother is found on ultrasound to have a trouble with the fetus, where there's an abnormality of the brain or spine, we can see the baby and the mother and actually even get an MRI before the baby's born to prepare if there's something that we can fix.
So explain this to me. If the mother has some type of trauma, is that an indicator perhaps down the road or anything like that? I know you mentioned trauma is important.
Trauma, it comes into play with the older children or the toddlers, but there are incidences where if there's a car accident, even a minor car accident, there can be problems with the fetus. But this is something, as with everything in stroke, prevention, recognition, and then medical treatment can save lives.
I think that's a great segue into symptoms. How do you know if this is happening?
So after birth, if you notice things with the baby, such as the baby's using one side of their body more than the other significantly, if the soft spot on the baby's head becomes very full, if a baby vomits or a child vomits in the morning when they wake up, these are all symptoms that would say, hey, maybe I should see a doctor.
The vomit being consistently?
Consistently in the morning, because that's when the pressure on the head is higher with laying down.
Okay.
In children, unlike adults, one of the main symptoms is seizure, as opposed to paralysis or speech disorders, because we don't see the speech necessarily in a baby. So if a child's seizure, if you see shaking on one side of the body, staring spells, things like that.
If you see any of these things immediately, I know it's going to catch you off guard, but what do you do? What's the first thing you do?
Well, the first thing is to recognize and get the child to the emergency department. Yes, because in stroke, whether it's a child or an adult, time is brain. And that means that the sooner we intervene and then treat, the more brain can be saved. As
a doctor or a neurosurgeon, what are the treatment options out there?
So we think of strokes in two different ways. One is a white stroke or an ischemic stroke, where it's a blockage of a blood vessel that deprives that part of the brain of oxygen. Then there's a red stroke or hemorrhage, and there are different treatments. In pediatric neurosurgery, we often treat the red strokes, which is a hemorrhage, where we sometimes have to go take out the clot or find out why there was bleeding in the brain. We have a very good department at St. Mary's for interventional, where we can put catheters in and remove strokes from the blood vessels in the brain before they cause damage. So those are different treatments and sometimes just medication.
Wow, Dr. Schwartz, scary to think of, but important knowledge
to have.
Thank you so much for coming in.